Well, welcome everyone. So happy to see everybody coming in tonight for tonight's study club. We have some very special guests with us. I'm going to wait a few minutes here as everybody's coming in for tonight. Love to see a show of hands who was just affected by the storm. I know that Dr. Wilkerson won't be joining us. Him and his family did get hit pretty hard in St. Petersburg by Hurricane Helene. And so raise your hand, anyone. You can put up your little in your chat sign down there. How many people have been affected or know somebody? Just all our prayers and thoughts going out to those families. Just that are struggling, whether it was the flooding or actually had the storms. I know in my own backyard, had some trees down, did have a little branch come through. So, but I'm going to say that is nothing compared to the amount of flooding. So just want to kick us off as people come in. I don't see anyone who's in the chat. See a few people. Hello, Michelle. Say hello. You can let us know where you're coming in from, everyone. Love having you here. So we're going to start tonight with a survey. So I have to tell you, when I met these two lovely ladies that you're about to meet, we have Kristie Michel on with us and Amanda Nash. They are going to blow your socks off. But I have to start with this. Who knows what the social six is in dentistry? Tell me if you know what that is. Who knows what social six is? I'm going to scan here in the chat. Please go in the chat. Hi from Castle Rock. Dr. Gina says she does not know what the social six is. So the girls are taking a look. Oh, I see somebody coming in there. No idea, Janet. Lacey's got an idea out there. Who else knows what they think the social six is? Hello from Tucson. Hello from Lakewood Ranch. No idea. Another one.
We have no yeses so far, do we?
We have one. Lacey.
Okay, one yes.
Lacey
Okay.
knows. Happy to learn. Oh, Rose. Rose knows. I have another one. David knows. All right. Well, I'm going to kick it off here because these two amazing ladies, Kristie Michel and Amanda Nash, are going to share some of their insider secrets, which really, I hope, inspires a lot of us, have a great conversation around it, around systems, and just really how to get things integrated into practice. That is always, to me, at the core and the heart, I'm going to say, of what we're doing, because we can go, how many times, Dr. Gina, do we say, we go to all these lectures or conferences and we get really great knowledge, but bringing it back and implementing it, I say people kind of hit the wall. That's really the hardest part, is like, okay, now how do I bring it into my practice? So that's the insight that you're going to get. And so I'm going to turn it over to these lovely hygienists, but Amanda and Kristie, tell us, are they correct? I see some 6 through 11 coming in. I see some maxillary anteriors. Yes, anterior smile. Girls, tell us what that is.
Bingo. Ding, 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 ding. So the social six, it came from, we were trying to create a name for a study club, and we were racking our brains on what we might call it. And we were thinking about just funny things, funny names. And that's one that we've used a lot over the years. Just between us, we've worked together for a long time, and we thought that would be pretty cute. And we decided that we were going to meet at 6:30. So we thought we'd incorporate it together to be the social 6:30. So it does mean number 6 through 11, the social six, the ones that your patients like to brush, but they don't want to go farther than that. So
good hit. Go, 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 go.
Well, yeah. I love it, but I have to tell you, being from Ohio, and I don't know, maybe my local Ohio girls will come in the chat and yell at me, but I never called it the social six, but I think it's a really cool. I see Dr. Hanley and a few other doctors like, of course it is, Laura. But I love that you guys took that name and created something very unique with it, because it just kind of speaks to just not only the practices you've been in. And so tell us, we love that you started this wanting to help other dental hygienists. I think that's the other important piece of just where your really heart lies, being so authentic. But tell us the background, how you guys came together, introduce yourselves. I love the story because, you know, the two of you have really you know, I had that person in my life kind of follow each other in your hygiene careers. So kick us off with that. Tell us a little bit your story of how you guys have managed to do this together.
Yeah, well, my goodness, we've worked together now since 2016. Before I entered the world of dentistry, I got a bachelor's degree in Spanish from Western Washington University here in Washington State. And the joke in my family is I picked the shortest major so I could get college over with and get on to hygiene school. And it's true. That's exactly what I did. But I did graduate from dental hygiene school in 2016 at Pierce College. Right out of hygiene school, I was the president of our Mount Rainier component, which was a crazy experience. And I don't recommend necessarily jumping right into a leadership role right out of hygiene school, but it was really fun and exciting. I worked at Dove Family Dentistry since graduating, and I temp actually quite often, even still, but there was a time where I was temping on every single off day I could get. But it really opened my eyes to lots of different dentistry out there, lots of different things that are going on in the dental hygiene world. But yeah, after COVID, Amanda and I founded the Social 630 Study Club, and we'll talk about that a little bit more through the presentation, but we meet bi-monthly, and really it was a way for us to break down that feeling of working in an island or working on an island and create that camaraderie and that taking that non-judgmental feeling that we have in our practice and for each other, trying to spread that out amongst our local hygienists. I'm married. I've got 2 kids under 3. My daughter started preschool today, so life is a little bit busy. Yes, yay for preschool. But yeah, we have a wonderful time together.
Yeah.
So I guess I'll take over from here. My name is Amanda, and Kristie and I have worked together since she graduated hygiene school in 2016, right?
Mm-hmm.
Yeah.
Yep.
So she came to work at our office right out of hygiene school. And we oh, is that someone speaking? All right. So I graduated with a bachelor's degree in 2009, and my first year and a half I spent in public health. After working in public health, I moved to Washington, and then in 2010, and then I've been in private practice ever since. So I kind of have a little bit of variety in my background, but I wanted to be a dental hygienist ever since the 2nd grade. So hygiene is really where my heart lies. I love patient care. I love taking care of patients, but I love the community that dental hygiene brings. I was my class president in hygiene school. And so when I met Kristie and she was already the president of our local component, I was just so pumped because we just have such like minds and a like heart for serving, for community, and for our field of dental hygiene. I am married. We don't have any children yet, but we are currently building our own home in Buckley, Washington. So like we've said, we've worked together for a little while. We've served together in some capacity too outside the office, but our dental office has gone through significant change in the 8 years we've worked together. We've had to really redefine who we are and where we are going with a large turnover in staff over these years. And we've had to make many difficult conversations through the years, which I think really helped us define what's important to us in dentistry, what's important to our practice. For example, our hygiene lead left in 2020. She was a hygienist for, gosh, how long did she work there? 18 years. 18 years with our dentist. And she left in 2020. And that really kind of gave this little window of opportunity, trying to turn a real big negative into a positive. We saw an opportunity to grow, and our dentist saw that hygiene, while of course it's a clinical need, it could also be a really big business opportunity too. So we took the opportunity to really grow and expand our hygiene services. We grew our dental hygiene team from a team of 3 to a team of 5. We've actually increased our dental hygiene production from 2022 to 2023. We increased it by 250,000 in a year.
Without trying. We weren't trying.
We really haven't tried.
We didn't actually care about it.
We were like, what's
it just
production?
Happened. Just so you know, we didn't really actually care about it. We can't claim that, but
yeah. But in the past 4 years, we've implemented various products for resale and hygiene therapy side
new technologies, we've created new protocols, and we've really elevated our dental hygiene care.
All right.
I just have to jump in while you're going to get started with your slides. Like, okay, that's like the ultimate hygiene line. I just have to say, all of us hygienists out there, I'm looking at all of you. I see Holly shaking her head. Michelle's out there. It's like, yeah, you know, but we've always said in dentistry, when you do the right thing, the money comes. And I truly believe that. And that's what you're going to show us tonight. But I just have to share that, and the doctors that are listening to kind of take note of that. I believe all of us hygienists, our hearts are always, that's why we became healthcare providers. We just wanted to help, and integrating these things are so positive, not only for us to renew our passion, as you're going to show us about tonight as an inspiration, but look what it does for the practice. So that's phenomenal. So take it away.
All right. So let us take you to a better place, elevating patient care in the dental hygiene op. Thank you to those who are just hopping on and joining us now. We know many of you are here on the West Coast and just getting off work, or maybe you're on the East Coast and you're really wanting to get to bed, because I know it's way later there. But we appreciate that you are here with us tonight, and hopefully you take something away that's valuable that you can take back to your practice, or maybe you're inspired by something. But wherever you are, thank you for being here, and we hope that you learned something new tonight. We are going to start this off with just kind of doing a brief little overview about product integration. Product integration, over the last 4 years, we've successfully integrated multiple new products into our office. Some not so smoothly, some smoothly. I said successfully, didn't say smoothly. And with this experience, we have just kind of gained lots of little nuggets here and there that we're going to hopefully share with you throughout the night tonight. But before you integrate any new system, product, it's important to do a strong self-assessment. This can be applied to every role in the dental office from front to back. During our self-assessment, we need to ask ourselves, are things rolling smoothly, or do we have cogs in the wheel? Are we completing all of the tasks in our appointment or in our day that are essential to successful patient outcomes? These can be your head and neck exams, your blood pressure. Are we already doing the things that we are supposed to be doing, those life-saving assessments? If we're not doing those simple life-saving assessments, probably adding new products or programs or therapies isn't maybe where you need to start. And so we just need to ask ourselves, if we're doing those things. In our dental hygiene department, this meant breaking it down to the basics. And this is where we started when we started rebuilding our dental hygiene dream team, as we like to call it, 4 years ago. Take it away, Kristie.
All right. So here are some 4 considerations that you might want to consider when you're just beginning to implement things into your practice. So we're going to dissect product integration. And, you want to consider the clinician, obviously, or the one applying it, the treatment or the potential treatment outcomes. What's the goal? Production and productivity. It is a business after all. We have to keep that in mind. And of course, I think one of the most important is the patient experience. So first and foremost, the clinician. Let's talk about that. As providers, we all want that clinical longevity in our job. We want to practice for years. I hope so, at least. For me, I was struggling in all 3 of these things around 2019, if I'm being really honest. Physical burnout. My back was sore. I kind of was thankful when we were shut down for however many weeks we were shut down, because it gave my back a chance to rest. We want to make sure that physically we're well, and onboarding new technologies can be very exciting, but it's essential to consider that physical impact that can happen when you don't know what you're doing, starting with a new product. Will they improve your workflow? Will it create more barriers, or maybe both? Kind of a funny story. We got those awesome little backflow valves for our saliva ejectors, but oh my goodness, those things will knock right out over and over and over again. Like, there were some appointments where I was losing 3 to 4 saliva ejectors in a 1-hour appointment. And we were just like, we got to figure this out. This is great that we have this new tool, but this isn't working. Lo and behold, we had to get a different thingamajigger to put the barrier in, or to put the backflow valve in, to put the saliva ejector in, all is well. But it's little things that you just don't know you're going to run into when you're jumping into something new. Another example is our air polishers. We had started off with the handy EMS little handheld devices. They're really heavy. They're starting to wear on our shoulders and our wrists. So we needed to figure out, gosh, what's the next step from here? Mental burnout. I was there too. So experience has shown us that onboarding new products can be overwhelming. So are you in a good place to begin onboarding new products? When considering integrating new treatment methodologies, it's important to give voice to the team lead or the team in general, say, hey, this is what's going on. What, I need help in this arena. Leadership within the department is not necessary, but it's helpful because it does create that role of responsibility and ownership in that department. We have various team leads in our office, one for the assistants, one in the front office. Amanda is our team lead at our office. And it just really helps to create central points of contact amongst everyone. And then, of course, career fulfillment. Does this new product, new treatment really help me enjoy my job more? I would say that now I am loving being a hygienist. Like, it has taken me from like, do I really have to pick up that coronal polisher one more time, to like, oh my goodness, look at this. Wow, let me tell you all about this amazing air polisher patient. Like, this is so fun and great. But we all know that dental hygiene can be extremely repetitive. Many clinicians complain of being bored. I did. And updating our protocols and procedures has been an effective way to really help me re-engage with my career and our team, and play an active role in my patients' periodontal care.
So that takes us on to treatment. When onboarding any new treatment, it's helpful to plan ahead and think about its potential impact on every area of your office integration. So I have it split here into 4 different sections, just kind of based on what my mind goes through in our hygiene department now when we start, talking about or get the conversation going about maybe new or different things that some of the girls want to integrate on board. The first one is research. Review the product and the science. Can or should this product be used in my office? We had a kind of a funny one like last week or the week before. Our Patterson rep, who we love, stopped by, maybe it was a few weeks even before that, but she stopped by and dropped off some samples, as she does often, of a new product that was released. And this product was supposed to be I think it's a pretty great product, and it's supposed to be really helpful for like aerosol reduction, all sorts of good stuff, and can be added to your water. And she said, oh, you guys have these air polisher units. I think it would be great for you. And because of the past experience that we have and the different things we've been through, normally I would have been like, yeah, that sounds great. That sounds awesome. But that little check inside me said, oh, hold up. Like, we just got these air polishers not that long ago. We don't want to ruin them. So we need to make sure with the manufacturer, is this okay for our product or for our equipment? And so just those little things, like do your research. Don't just rely on what someone else tells you. Even though we love her and we trust her, she was just spreading the good word. It wasn't like she was trying to do us any harm, but it was a good thing that we did check, because we did find out that it isn't actually compliant or approved by the manufacturer's warranty. So just something to think about. So another thing is under research, just weigh the risk versus reward. Understanding products and when and how they should be used is essential for successful patient outcomes. A good example of this, I feel like I learned this from Laura Hooper, is about antiseptics and antiseptic resistance, and how it's, can be a good thing if and when you need it, but if your patients are overusing it, it's not going to be helpful when they actually really do need it. And that moves me on to the second little box there, and that's cost. Does this product pay for itself? Is usually what our doctors want to know. Is this product going to pay for itself? And I think the thing that I've learned over the last few years is that it doesn't always just directly pay for itself, but you have to think about, can this product pay for itself in other ways than direct revenue increases, such as time management or improved ergonomics for your staff? So you're going to get more longevity out of them or out of yourself. So I think there's a lot more that goes into that cost thought, although that usually is like the one that is the neon sign, the highlighted one for the doctors in their mind. But I think that there's a lot more to it than that. Just over the last few years, I think we've been so shocked and surprised, even though we've spent a lot of money on equipment and different things, you know, even still, we still see an increase in our revenue like we have. And some of the decisions we've made haven't been because they were going to be cost effective as far as a direct revenue increase. The third thing is training. Training should always be considered, yet it is very seldom done. And this is, we can atone for this one in our office as well. We haven't always been perfect at training for when we've been onboarding products and procedures or therapies, but it should always be done. We must prioritize providing training to give our staff the tools that they need for success. And then the fourth box, integration and workflow, realistically understand the time it may take to onboard some protocols, products, and procedures to the point of proficiency, especially when working from front to the back office. It takes a long time to get everybody on board. And we'll kind of deep dive into this a little bit later with salivary diagnostics, but it takes the whole team, takes the teamwork to make the dream work. It takes the whole team to make things run smoothly, right? So that's just the four things that I kind of broke down in my mind when weighing, should we bring this treatment into our office?
So on to productivity. What are your office goals? You know, what do you want to happen? I think that's a really great first question to ask when considering if a product should be brought on. And considerations for overhead costs, you know, administration implementation, considering dental coding, the fees that might be involved, training for the front office, staff, etc. What about staff implementation? What products do you need to order to get this treatment or a new product rolling? Implementing the protocol, the time it takes to train to actually use it, and a clinician administration time. So what does that do to your dental hygiene appointment? Do you need a longer appointment to apply a new protocol or a new treatment? Another thing to consider is, will it require patient buy-in? How, you know, sometimes that takes a lot of work for a patient to say yes to something that we know that they need. And that can be tricky, but, you know, consider that when you're considering productivity. Does it require extra chair time? You know, how long does it take to get something set up? That's important too. And will it generate revenue? That kind of goes into what Amanda was talking about earlier about cost. You know, productivity doesn't necessarily mean money. You know, how consider the time that it takes to get that product up and rolling.
And our final consideration, patient experience. Patient perception can be a really big thing. We need to put our best foot forward. A patient's first impression of a new service comes down to how you present it. A good example of this in our office is last year, Kristie, one of our other hygienists that used to work with us, who we just love, and I created a myofunctional therapy program. And it is from start to finish, from front to back. You have to make it cohesive and consistent to sell it to your patients. We believe in it. We know it's great. We know it works, but we have to show the patients that it is of value, right, to get their buy-in. So that means from the paperwork that they're signing in the waiting room, their informed consent, all the way back to the back in your forms that you're filling out, the templates you're using, everything needs to show that this program, this therapy, this protocol, whatever it is worth it. The second thing is comfort, being sure to research the pros and cons of products and procedures in relationship to patient comfort. For example, our air polishers. Like she was saying, when we first implemented air polishing, we were using the airflow handies because it was a really inexpensive way to kind of get our foot in the door, to get our doctor to let us start air polishing in the office. But the biggest complaint that we had was that it was cold. And so anybody with any cold sensitivity really didn't want that procedure done on them. And the hard part is you're kind of undoing later what you've done, what you've done. So some people are like, oh no, I had that before and it was too cold, I didn't like it. And so now we're saying, no, it's better now, it's better, it's warmer. We promise. So just researching things out a little bit more thoroughly, because even when we did add aftermarket heaters to our water units to try to remedy that situation, it's still, the water wasn't warm enough for some of our patients. But now switching to the units that we do have, even my doctor's wife, who has to be numb to get her teeth clean because she's so sensitive, she even says that she's totally fine with it. It was great. So we got it. It's a night and day difference. Communication. Prepare and equip your department or staff with appropriate vocabulary for patient education. The length of your appointment and answers to basic questions that patients might have. Appointment duration. Consider additional time needed for patient education or procedure. And then finally, the appointment cost. Be aware of your clientele. Do you have an insurance-driven office, or are you a fee-for-service office? This will play a big role in how you may proceed with your integration to ensure a positive patient experience. Our office is insurance-driven, so we have to we have to fit within the limitations of that, because that is how the office is set up. So we'll get to this a little bit more later, but our one of our mentors with our phase contrasting microscope is the great Barbara Tritz. We just love her. And she has the ability to do her microscope biofilm slides on every patient. In a perfect world, that's exactly what we would do. That's how we would start our appointment. We would love to do that. We, unfortunately, do not have that amount of time with each patient to allow for that. But we try to strategically use them in the best way possible that fits within our office. If we had 90-minute hygiene appointments, we would be in absolute heaven. So that's our goal, right, Kristie? Yes. All right.
All right. So now that we've explained what we consider when onboarding a new product or protocol in our office, we're going to switch gears and show you some of the tools that can help improve your dental hygiene diagnosis. So the two most helpful tools that we use are salivary testing and the phase contrast microscope. These tools have increased our treatment acceptance and improved our treatment outcomes.
Historically, we were taught that periodontal charting and radiographs were the primary tools to identify periodontitis. But over the past couple of years, we've learned that there is much, much, much more than measuring a past history of destruction. We do use periodontal charting and we do use radiographs, but we are also using our phase contrasting microscope and our salivary diagnostics to help improve our patient acceptance and give more accurate diagnosis for our patients. The microscope in specific allows our patients to be able to see and show their patients their living, moving, and changing biofilm. As Kristie would say, a picture's worth 1,000 words, right? And our salivary diagnostics help us get to the root cause of our patient's oral disease. In the future, we hope to include the bottom one. The reason why it's not bold is on purpose because we don't have one at this time. We have the approval to get one, but we have decided that we are trying to not take on too much. We're trying to be patient and make sure that we're there, that we're emotionally ready, that we're, in a smooth, we're rolling smoothly and there's no cogs in the wheel before we onboard that dental endoscope. So we're trying to practice what we preach. But at some point in the near future, we do hope to integrate an endoscope into our periodontal therapy. For the next few slides, we're going to focus on how we can utilize and how we have implemented the microscope and salivary diagnostics in our office.
Okay, so here is a video that was taken, just a couple of weeks ago of the process of taking a biofilm slide. So you dive right in there with the scaler, get some plaque out, plop it right onto your slide, put a little cover over it, and you use a little solution to help keep those guys alive in there. It's a pH balancing solution, so the bacteria actually stays alive. We've had some slides still swimming around in there over to the next day,
or the weekend.
Yeah. So this stuff works great. This takes less than 5 minutes to go from the patient's mouth to the image on the iPad where the patient can observe their bacteria. So like I said a second ago, it's a pH balanced solution, or a prep is what we use. Then the slide is sealed with Aura Seal prior to looking under the microscope. So the microscope itself is initially a little bit of an investment. Ideally, one microscope per that can then go to Wi-Fi or a TV monitor in the room if that's something that you have. We only have one microscope in our office, so we share between 4 hygiene operatories, and then we connect Wi-Fi to our iPad, and then the iPad we bring into the patient operatory to show the patient what's going on in their mouth. Although we share one microscope for the whole office, we rarely struggle with sharing it because it seems to flow pretty seamlessly. The products that are associated with the dental microscope are pretty inexpensive, less than 30 cents total per slide, and it takes less than 5 minutes, as I said earlier. As we said, it's pretty quick. It's really best to not do them on the fly and kind of pre-plan your appointment ahead of time so you can have all your little goodies out and ready to go. I sometimes do them on the fly, and let me tell you, it's not ideal, but it's best to plan it out. That way our assistants in the back or our sterile tech know that we're coming in with the microscope. Slide 2. This is a really great resource for patients that are longtime patients that, you just can't get them to agree to the periodontal therapy. This is a great way for the patients to see what's going on in their mouth, and we can compare then and say, hey patient, I see some spirochetes active in your mouth. That's not a sign of health. And to walk them through that process. When they see it, we really have high patient acceptance. Yes, let's see here. Here's a great little video. You can kind of scroll. This is scanning on top of our microscope. You can see the microscope image on your far right screen, that little black screen above the little graphic there. That's what we're recording on, and you can see all the bacteria swimming around. But my most favorite one is this next
one we're going. Okay.
Yeah, let's go to it.
All right.
So here's a microscope slide, and you can see this little guy right there in the center. My goodness, look at him go.
He's going to town.
It looks like a little mouse. It's a parasite. So we found this actually on one of our very first days using microscope slides.
It was the very first day.
Wild.
So we had to use this video because I don't think we knew what we were signing up for or getting into.
Because right when you see that, you're like, oh my goodness.
But we can thank Barbara for that.
Then you can, when there's one, there's likely many, many, many more. We just lucked out to see one right there at the ready. I know.
All right. So moving on, we're going to deep dive here into salivary diagnostics. In our office, we do not have a strict protocol on who should or should not be salivary tested, as we truly believe it's beneficial for all. But practicing within the limitations of an insurance-driven practice, we unfortunately do not test every patient who walks through the door. But we do have some loose guidelines we have in place prior to testing, and we want to make sure that the patient wants it. So we try not to oversell, and we try not to overpromise. And these things have come with, I think, just time. When you do things after a while, you kind of just learn little tricks of the trade. And so take that one seriously. If you're seriously considering onboarding salivary diagnostics, really just know that the patient has to want it, because there's a lot of follow through on their end. If you are striving for a successful outcome, or if the patient has an expectation of a successful outcome, it's 98% on them. We do like 2% of the treatment. So that's just one thing that I just really wanted to reiterate for salivary testing in general. If a patient tests, it is ideal and is almost becoming required in our practice to have the spouse or partner test at the same time, as it's next to impossible to resolve the patient without seeing the big picture. When diagnosing non-surgical periodontal therapy, we almost always automatically treatment plan salivary diagnostics in conjunction with our non-surgical periodontal therapy. And what this looks like is when they're in that initial new patient appointment and we're writing down what treatment, what periodontal therapy they need next. And we're saying it's 1 to 3 quads isolated upper left, 1 to 3 quads upper right. And we're writing down those tooth numbers and we're giving that information to the front because of course we're insurance driven. So we have to do all that documentation. We at the same time are adding that code in for salivary testing. We are billing the actual code to the insurance companies, but we are telling the patients that most likely they won't have anything covered. But we want to make sure that we're turning those codes in because we want those insurance companies to see that we value that diagnostic tool, that code is being used in our office, so that hopefully one day maybe that will change for patients. We have a strict protocol with our front staff that requires the test to be administered or scheduled no later than 3 weeks prior to their non-surgical periodontal therapy appointment start date. The 3-week gives us enough time to receive the results and then create and deliver the patient's individual treatment plan prior to their appointment. So follow me as I walk you through a step-by-step our salivary diagnostic protocol. Our first step is to administer the test. Assistants and hygienists in our office both administer these tests. It just depends on whose side they get scheduled on. If I have time in my schedule, they'll slide them with me. If they have time on the assistants or the doctor side, then of course that'll be scheduled with them. If we can fit it in our new patient appointment, for instance, if you have a husband and his wife has already been in as a new patient and she got salivary tested and we had told her that we want to test her husband. And so that husband comes in already knowing what salivary diagnostics are, already prepared, already has the patient buy-in, then we're going to do that at the beginning of the appointment. And we'll kind of go over that here in a little bit, but we will do that if the timing is correct. But we try to stick to our schedule that we have, our outline, I guess, for our appointments, because that's really what's going to keep us on time, because we are providing a lot in a small amount of time because of our limitations being an insurance driven practice with 1 hour hygiene appointments. But we don't want to run behind. We want to be thoughtful of the next patient, but we want to also provide that high level of care. So then the second thing we're going to do is we're going to log all that test information that we just recorded. So on the box, we use Simply Perio, but there are a lot of other good tests. Bristle is an awesome test. Oral DNA has a lot of nice options as well. We really like the viral component to Simply Perio. We're enjoying using that. So that's the one that we're using right now. That's the only reason why the picture is up there. For the test log, we're going to log their name, their date of birth, the date, and we'll kind of give a little bit of a blow up image here later, a close up, of the test log in case anybody wants to see that. And we're happy, of course, if you contact us. At the end, we'll have our emails. If you would like any PDFs or anything, we're happy to share. We did create all this stuff pretty much ourselves. Some of it we had help from Laura with indirectly, but we are happy to share. And then the third thing that we do is we package and ship. So we created a little bin or a basket that sits not far from our log, and we'll show you that here in a little bit too, where we have the outgoing mail. And we have a little bit of an order to that. Once on the log, the name has been highlighted all the way across. That's when we know it's been ordered into the computer. So on the laboratory's interface on their website. And that's when we know that the test can go from that white bin into the actual mailbox, because these ones do get mailed via the USPS. The fourth thing is to order the test, like I was talking about, but then also do your chart notes. We document. So we document when we administer it, we document it when we deliver the results. So that's what the number 4 step is. And then the 5th step is starting our presentation guide and tracking our progress. Our 6th step is checking our results. Our 7th step is reviewing those test results. And you really, with the checking the results, sometimes with the test that we're using, it takes 1 to 2 weeks, maybe 2 to 3 weeks sometimes on certain results. So we're constantly having to kind of every morning get on that website and just check that laboratory interface to make sure that we are seeing all the tests that are rolling in. Number 8, presenting that or completing that presentation guide. This is one of the most essential parts of salivary testing, is creating a really thorough treatment plan for the patient that's understood, not just by us as the clinician, but also throughout the whole office. Because if this patient is to come in for a restorative treatment on the doctor's side and asks about their salivary test, we want it to be so easy for the doctor to pull up the information and be able to talk with this patient about it without it being awkward or him fumbling around. So this presentation guide is really key in our office for good communication across both sides, from restorative to hygiene. And then step number 9, delivering those results. Depending on the patient and what they prefer, we will email the results or we will deliver by phone. I personally prefer to deliver by phone. Many offices will actually have them come back in and do like an in-person consultation. We would love to do that in a perfect world. The reason why we are not able to is we have pretty big practice running out of a pretty small building. So we only have 6 operatories, but we have on Monday, Tuesday, and Thursday, 4 hygienists working all at the same time and 1 doctor. And we used to have 2 doctors working on Wednesdays together. And so we just have, every chair is busy all the time. There's no downtime for any dental chair in our office. So we are maximizing the production out of our space, really. So we don't have the time to bring patients in for those in-person consultations unless it's a really specific scenario. So we deliver our results via phone or email. Moving on to chart notes, we then, of course, document. Number 11, tracking the progress. We're going to deep dive into our binder here in just a few minutes. I know probably some of you are wondering, what's with this binder? What's with the tracking progress? I want to know more about that. So we'll open up the binder here in a few minutes. The 12th step is then, of course, finally getting to the treatment, what you're going to do for the patient, because it felt like a long way here, huh? And then step number 13 is retesting after treatment. We typically like to do it about four to 6 weeks post-treatment. And then once we get those results back, we review the results. And then after we get those results, these are the things that it's super important to know, is that you're not all of a sudden always just resolved. Every case is not straightforward, as every person's health is not straightforward. Getting to the root cause can sometimes be really easy, but resolving the root cause is not. And so reviewing those results and then deciding with our little decision tree there, if the patient maybe doesn't want to proceed with treatment or can't proceed with treatment. I have a case right now that's pretty complicated. My patient has cancer. She's been in chemotherapy and radiation for a long time. I threw her biofilm slide up on the microscope a while back, and it was filled with parasites, filled with disease. Her biofilm was so sick, so unhealthy. She cannot take probiotics. Her gut is like, just taking a probiotic made her start like throwing up. The first time I had her take a probiotic, oral probiotics made her stomach upset. So she's in such a state of dysbiosis that what I'm doing, I can't really help her to the extent that I want to, because her situation is so unique and so different. So sometimes in some situations, it's going to be a situation of managing that case. Sometimes it's a situation of what we all hope, and that's resolving that case. And sometimes we retreat and we try again with maybe a different approach. And so, or maybe we have to retreat because the patient didn't follow our instructions too. So that's another variable that's in there. So that takes us to the end of our steps for salivary diagnostics. Now we're going to deep dive into just the nitty gritty of our protocols.
So here's a photo of our office. You can see on the picture on the left, those little sparkling swirls where the this is the log on the left in the cupboard with where the doors open. That's where right when we take a salivary test, we are writing the information down that's pertinent. So we know when it's time to enter this information into the computer. So we take our little test box and put it onto the shelf in our little white basket there. So that's our visual reminder that we do have tests to go out. So when those tests get mailed, we are also entering that information into the computer, and then we highlight once that test has been entered so we can know we're waiting for results on that patient. Let's see here. So here is that test log, nice and big. The date, the barcode, first name, last name, date of birth, gender, provider, whether this is a post test, and then we check it once it's been ordered. Ordered meaning being entered into the computer. Then it gets highlighted. That's our system at our office. So we know every step of the way where that test is and where it's going to.
And before you click on that one, we link the provider to the person who treatment planned it. So the person who treatment planned it is the provider. So whatever dental hygienist recommended that salivary test, it gets linked to them. Mm-hmm. So that way they have the ability to track it. So even if the test was taken in restorative on 10 a.m. and our hygienist Bethany wasn't in the office, she still gets linked as the provider for that test, even though she didn't administer it, to keep things really clear. And we started this from the beginning of doing our salivary testing, and it has boded really well for us to keep things really just straightforward. Yeah, just so it's understood, there's no confusion. It just eliminates a lot of problems. So whoever recommended the treatment or initially treatment planned it gets the credit for the test, production for the test, even if they didn't administer it. But mostly the main thing is that they are the provider, and so they can follow that all the way through so that someone is accountable for that test and delivering the results.
So what's in this binder? These are our most favorite little things. Blank presentation guides. So sometimes when I'm administering a test, I'll bust out that blank presentation guide right away and start jotting my notes on it. So I remember why in the moment during that appointment or at the end of the day when I'm doing my chart notes or something like that, what were the reasonings behind my test, or was it just patient curiosity, or did they have some interesting things on their health history? Just keeping myself fresh on those presentation guides. We also use an Excel tracking sheet for each individual provider. So this is like my patients are in this binder of where are we at in this process with this test. Open cases, so something I'm working on, or do I want to research something more? So the open case, the test results that I may have received with my presentation guide and the results, and then also a product reference sheet. So, we go to all these CDs, we hear about all sorts of new products, we listen to podcasts. I'll sometimes just jot something down on a piece of paper, tuck it in my binder to remind myself later, like, oh, that's right, that product worked with really well for dry mouth even, or
TD or TF.
TD, different bacteria. Like there's so many things that we hear, but it's nice to have a little cheat sheet in there for ourselves. So here is another example of a tracking sheet. This is, Amanda prefers to use this way, where she prints off this piece of paper right here is just the print off from our Simply Perio website. And she just goes through and highlights the patients that are hers. That's one nice thing too. We do have a lot of freedom in our office. While we have protocols, these individual things like your binder, you can manage it the way you want to manage it, as long as you're getting the job done. We just have lots of different ways that work for different hygienists in our office. And so we're showing you a few different options that people have created. So that works really well for her.
So at the end of every week, I just print that off. I just right click on that when all the results are sitting there. I just right click on it. It gives a list of all the patients whose results are in, and I just 3-hole punch it and slide it in my binder, and then I highlight the ones that are mine. And then when I have an orange dot, that means that those have been I like downloaded their presentation guides into the computer, or not presentation guides, their actual tests into the computer.
So this is kind of like our holy grail right here. My goodness, this presentation guide, we love it. It just makes it so easy to review, why did we test? What are the results? Are there additional referrals we want to make, ENT, naturopath, etc.? Just some of those little conversation pieces that you might have gone over with the patient.
Cause?
What's the root cause? We're trying to get there.
Is it airway?
Yeah, is it airway? So many things. And then we can also have this nice little middle section where, what's our treatment plan? It's also helpful for the front office to see this. Our ladies that work our front office, they will sometimes refer to this and say, "Oh, I did see that Amanda had recommended, the not NSPT, non-surgical periodontal therapy with the ozone and laser. When are we going to schedule that?" So it just creates a seamless resource in the office. This is another tracking log that Haley, one of our hygienists,
I've actually been using it lately.
Oh, good job.
I've actually been using her log lately.
This is another nice way that she likes to do it in the computer, and then she'll print it off. But the date, patient, last name, first name, initial test or post test, did she complete the note? Did she deliver the results? Results in oops, what is that?
Smart Doc.
Smart Doc. There we go. Did she scan the results into Smart Doc? Has she done her presentation guide? Did she need a prescription? Did she send that off to the pharmacy? And then the delivery note, or delivering the results to the patient. And in our office, we also have these two little folders that sit right next to our computer and sterilization, to be scanned and need to shred. So, we'll pop our presentation guides into the to be scanned file once we're done with them. And then one of our assistants will scan in all those documents. We use this for, all sorts of stuff in the office, but then they go right into the shred folder after that. Makes it really easy. And there's another bigger view of that tracker sheet that we use in the binder. Okay, so now that we've discussed all these steps to complete using the microscope, the salivary testing, let's apply it to our 1-hour dental hygiene appointment, because that's where all the magic happens.
All right. So on the left, I've included all the services we provide in a typical 1-hour adult prophy or periodontal maintenance appointment. Now we know why we're tired, guys. The asterisks indicate services that may or may not be done on a consistent basis throughout our appointments. In the book Atomic Habits, I don't know if anybody's ever read that book. It's one of my favorites. The author discusses the reasons why our brain loves efficiency. As we repeat a task, the things we do before and after one another stop becoming conscious steps in a process and instead become automatic prompts as our brain lays down new and faster pathways for efficiency and effort to preserve our energy for new or challenging interactions. This is why we can drive home from work and hardly remember how we got there sometimes. I relate with this one so hard, and that's why we have a specific flow to our appointments to be able to get it all in. If we do some of these things out of order, it really makes it hard to stay on time. I know Amber Auger's famous for saying, if you don't peri-chart within the first 20 minutes, forget it, your appointment's over. And I definitely agree with that. I like to get my peri-charting done in the beginning because it's part of that assessment tool. It's part of gathering that data, that information to know exactly where you need to take that appointment that day. Do we need to reevaluate for some isolated NSPT? Do we need to talk about this or that? So I really, really believe that sticking to a schedule or getting yourself in the habit of a schedule, doing things at the same time within the appointment, you get faster and faster and faster as you go. I know over the years, as we've implemented different things, we've all had the conversation, but how do we have time for that? And it's funny how with time after doing things, the new things you've implemented, you get faster and faster and faster, and there is time. But the key really is the timing of it. And so that's why when we say not doing biofilm slides or using the microscope on the fly, I try not to, because that will throw you behind if it gets placed at the end of my appointment instead of the beginning. If I know it's going to happen, our assistants, we have amazing assistants at our office. We're really blessed. Mm-hmm. They will have all that set out for us when we're setting up our room. We set up our rooms together a lot. And if they see that on our sticky note, we have I should probably take a picture of this. We have little post-it notes that we make during our review to know what services we're going to provide in that appointment that sit right next to our tray. And really, that is super helpful for just staying on task. And so then also our assistants know what to set up for us. So it's already set up. We're not scrambling. We're not rushing, trying to grab things. So if you want to elevate your care, make those life-saving screenings a habit first. If you don't have time to do head and neck exams or take blood pressure, then please do not consider adding other services. I know we said that in the beginning, but we're saying it again here. Do the life-saving screenings before adding the extras. We can't tell you how many times a new patient says, wow, my doctor, or says, wow, my doctor isn't even this thorough after receiving a head and neck exam. We transform our dental hygiene department starting with salivary diagnostics, or we didn't transform our dental hygiene department with salivary diagnostics. We started by calibrating our basic services. And so we just want you to remember, we didn't just, jump in and get here. It's a work in progress. And so wherever you are, take this and apply it if you need to. On the right, those are all services that we do provide in our office. We take A1C screenings on patients who don't know what their their A1Cs, if they haven't had it checked in a while and they are diabetic. We don't do it on everyone, but I would really love to see access to continuous blood glucose monitors for our patients, especially those who are pre-diabetic or maybe, kind of fall in that high risk category. But we do have these essential discussions with our patients.
All right. So as we know, oral is systemic. We have heard that phrase a lot from Laura over the past while, and it's the truth. We know this. We know that our oral health impacts our entire system. So biofilm is really at the crux of it all. Consider the patient's health history, think of referrals as a branch of your care. And that is something that I think has been really helpful for us over the past couple of years is we've sought out wonderful providers in our area and have invited them into our office to chat with our doctor, to chat with us, to see if they'd want to be a referral source for us. We have a fabulous ENT in our area, and that connection and that relationship has been really important. So that's something I would encourage everyone to do. Is there an awesome doctor that you hear of, or a really great ENT or naturopath? Reach out to them and see what relationship you can establish, because we know that the oral environment really does impact it all.
And we've done this in our office.
We've
reached out. We reached out to our local ENT, invited him in. He shared a little tiny 30-minute presentation with us. But it built a relationship. Mm-hmm. And now, he was so sweet. He shared his cell number with us so we can text about patients or, just quick little things if we have questions. So it's just really nice to have those really solid, good relationships, good referrals for your patients.
Before I got here tonight, I was actually at my doctor appointment, and I even asked my naturopath, I was like, so, would this be a great relationship to start? Like, we would love to have just another referral source as someone whose name I can say, and not just, do you see a doctor? Have you been to the ENT? And she was really excited to hear that and said yes. So that's something exciting too. Let's see here. Biofilm management.
All right, let's do this, guys. If you're not familiar with biofilm management, it's now becoming the new gold standard for dental cleanings, especially with implants. You're really able to thoroughly clean dental implants with the air polisher, with the subgingival powders that are now available. The full-size units from each company come equipped with piezos and air polishers, and the air polishers dispense very fine powders that can be used above and below the gum line. These systems are not messy prophy jets from my college days. They're ergonomic, they're quiet, and they provide near painless plaque removal. After providing air polishing in conjunction with ultrasonic during a dental appointment, it's hard to go back to traditional rubber cup polishing and hand scaling. I know even just for myself, I can't believe the relief that I got in my hands after using it for just, a month or two. And then also kind of on Saturdays, we both work at another office at the same office. We love each other so much. We work at our normal office together full time, and then we work at our other office together. I love going there. I love the people we work with, but I'm totally miss my air polisher. I'm having a hard time with the rubber cup polishing when I'm there, because the air polishing just makes things so quick if you do things in the right order. Some people say it takes longer. I actually feel like I'm way more proficient with it. You can see in the video here, and I can replay that again, we have an Optrogate on this patient. We don't necessarily Optrogate every single patient. I know some people do with air polishing. I found that I can keep patients pretty dry with the new units. We have currently the Woodpecker PTB in our office. We have 4 of them. We're pretty darn happy with them. Our other hygienist, Bethany, she works in our office 3 days a week, and then she works in another office. And it's a specialty office, and they're fee for service, and they have 3 airflow maxes. And she says very comparable, doesn't have a strong preference for either unit. The difference between EMS, airflow, and Woodpecker, not as far as their technology. I don't know a ton of difference in their technology, but I know the airflow has trademarked the guided biofilm therapy, and I have a little diagram there about what the guided biofilm therapy is, but it starts with assessment and then disclosing, and using that disclosing solution to motivate your patient, and then you airflow them, getting all of that plaque and soft calculus you'll even see melt away, and then you follow it up with the piezo, and then you of course check to make sure you got everything, and then the next time you see them is at their recall. And then Woodpecker kind of had developed their own little trademark. They call it ABC, Airstream Biofilm Clearance, and they have broken it down into if your patient's simple, moderate, or heavy. And so we've kind of tailored it to, I think everybody kind of does that. You work whatever works for you, your workflow and your hygiene operatory. But I do use, like today I used Optrogate twice, but I airflowed probably, I guess 6 or 7 times. So I didn't use it on everybody, but my patients who are wearing makeup or didn't want the mist or the overspray. But a lot of people don't really mind, and they'd rather not have the Optrogate in. So we just leave it up to the patient.
And in that video, that was our previous airflow handies. So that wasn't our Woodpecker unit. I have one of it. Our doctor bought us for all 4 hygienists. He each bought us one of the PTB units. So the Woodpecker is a great affordable option if you're looking for multiple.
Yeah,
we love it.
All right. So moving on, I do have a video using the Woodpecker that's playing right now, the PTB unit. So you can see how, maybe it compares. It pretty much looks the same as it going. I have our setups there, and just showing what we usually set out for those procedures.
That is a lot of products to use. We do have various things though, depending on the hygienist. We have why do I always forget what the mirror section is called? The Pure Vac. We have the Pure Vac, which one hygienist loves in our office. We also have the relief system that Amanda loves to use. I just love using like a high volume section cut in half with a little guard on the end, a screen, because I love the retraction with it, and I feel like I can section at the same time. So really it just depends what you need. We love the 2-tone disclosing solution. We also love the Triplaque. It's a little bit thicker gel, but we love seeing all 3 shades when you disclose, so the patient can kind of get a history of their plaque in their mouth. We have a lot of help with our assistants setting up this room, and they over time have kind of learned what we each prefer. They're incredible. We have really Cavitron units with the 360 swivel tips, as well as we have the piezo unit on the Woodpecker too, as well as various powders.
I'm just going to back up one thing I think I forgot. I just want to kind of show there are reservoirs in there. You can run off of your water in your office or the reservoir tanks and just fill your water as you go during the day. We have ozonated water, so we have an ozone generator. We haven't really deep dived into that, but we're about to in the next slide. So I just wanted to kind of show you that little reservoir tank on the Woodpecker and EMS. It has one there as well, where you can use or put your own water in there. So our adjunctive therapies in our office, we have ozone therapy. At this time, we only have an ozone water generator, and then we use ozone oil, but we don't do ozone gas. In the future, it's on our list, like the endoscope, but at this time, we don't offer it. But that longevity unit is a highly recommended unit for ozone gas. But it is also recommended if you're going to take the deep dive into ozone therapy to get some definite special training for that. We do utilize diode lasers in our office and also some subgingival medicaments, although we are very thoughtful and considerate when using any type of antiseptics in our office, including recommending mouthwashes. We don't ever recommend it for more than 10 days. We try to do it very controlled with our patients. Oral hygiene recommendations. So these are just a few things that we recommend when putting together those treatment guides for a patient or those presentation guides. We're really, really big fans of oral probiotics. I've seen huge success in my own life with oral probiotics, let alone my patients' lives and test results. So huge fan of oral probiotics. My personal, for my own go-to, I really like the Probiotic Pro. I've had the best success with that personally, and with those red complex bacteria for my patients. Supermouth toothpaste, Supermouth mouth spray. They have a pH balancing mouth spray that's really nice. We love any type of water pick, not just necessarily the name brand water pick, but in your oral irrigators in general. Electric toothbrushes, Stella Life rinse for our patients, especially who are going through chemotherapy, radiation, or maybe have mouth sores or special circumstances. We'll put them on Stella rinse for a time, or Closis if we've got a lot of spirochetes, or TD present for a short amount of time that we're having a hard time getting rid of. Gut probiotics, mouth taping. We do provide myofunctional therapy in our office. And so a big rule within our myofunctional therapy program is if your patient cannot breathe through their nose, then of course they are a poor candidate for mouth taping. So it's an instant referral to the ENT. We work really closely, like we were saying, with our ENT, but we do love talking about airway dysfunction with our patients, educating them, getting them the help they need, getting them sleep screenings, whatever we need to do. But we do utilize and recommend mouth tape when appropriate. Some other random things I listed over there that we like to recommend, just soft picks, interdental brushes. We love the Cureprox 12460. It's a velvety soft toothbrush, especially for patients who have like really, really chronic gingivitis or perio that has, and they are not wanting to brush their teeth. It's a really, really soft brush just to get them to start doing something until you can work them into an electric toothbrush. It's just a good, I guess, segue into getting them back into an oral hygiene routine. All right, so moving on.
So this might be my most favorite slide of the whole presentation, because we truly believe that this is our secret sauce. We can't do any of the things we do without the culture that we have worked so hard for in our office. We don't have to work on an island, as I said earlier, and I feel like a lot of hygienists feel that way. We work together, Amanda and I, me and Haley, me and Bethany, me and Joey, etc. Amanda, Joe, whoever, we work together on patient cases all the time, to the point where it's like, oh, hey, do you have 5 minutes? Can you pop into my room real quick? I swear there's a piece of calculus on number 3 mesial. I cannot get it off. Like, help me. It's funny how sometimes one person's hand or one person's skill is just right for that piece. And it happens all the time, back and forth. So literally, we work together scaling our patients. We work together on our salivary testing together, or even just a, hey, this is what I treatment plan for this patient. Do you think I should have done that? Or what do you think? What would you have done differently in this case? I think that's really how you learn together and how you become a trusting, really solid group as a team. We truly hold a no judgment perspective for each other. Just the other day, I had a wonderful mom in my chair with 2 little girls in her lap during the appointment. I didn't get through everything I wanted to get through. And so I know that the next time either I see that patient or one of my colleagues sees that patient, through my documentation, I know that they will not be, gosh, Kristie didn't get it all. Like we don't have that vibe in our office. And it's something that I find so valuable and so important. Now, and it's not just in our hygiene department. It's truly a positive culture trickle down effect. Our dentist, he wants us to co-diagnose, and we are providers alongside him, which I find to be so valuable and so wonderful, that it makes it hard, kind of to work for anyone else right now.
And it's not perfect. We don't want to paint a perfect picture.
We're not perfect.
But
he truly does treat us like colleagues. Awesome. I mean, it's kind of like family, you love them to pieces. There's hiccups along the way, but because of the culture we've created, we can also address those hiccups along the way openly and have that open door policy with everyone in our office. I've never felt more respected as a professional, even going past jobs that I've had before dental hygiene. But yeah, he really asks us our opinions, even on decay and treatment planning. He wants us to consider our periodontal therapy as part of the treatment plan and part of the process, and wants to integrate his treatment along into our dental hygiene treatment as well. And with our assistants, we help our assistants and the assistants help us too. If we have time and we can help them flip a room, we will help them flip a room. Mm-hmm. They are always on, our radar, and they're on our radar too. Like we want to help each other. And so that brings us back to our Social 630 Study Club. Amanda and I loved the atmosphere and the culture that we created so much. We really wanted other hygienists in our area to have that same feeling in their office too. So that's why we created the Social 630. It's fun to learn. It's fun to deep dive on, funny little topics. And, we tested each other's A1Cs last time, and that was really fun. But it's also to create that camaraderie and that team feeling amongst the people that are right, 2 offices down from us, across the street, to create that network of support for each other. But we really, truly feel like we are so lucky. That's a picture of our whole office there in the center. And then we got to go to RDH Under One Roof this past July, which was so much fun. And I was on maternity leave, unfortunately, but the picture in the bottom right, Amanda, Joey, Haley, and Bethany all got to go to Kentucky as well, to take some awesome CEs there this past summer. But yeah, so now we're going to move on to a few case studies. We just have 3. But here we go.
Do we have time for that, Laura? How are we doing on time?
Are we good?
We'll try to breeze through.
Yeah, let's go through at least one. Let's see in questions. If people want to start putting questions in the chat, I do want you guys to have opportunity to answer any questions. So if you want to throw any questions now in the chat, that would be great while they're going through the case.
So quickly here, this was a patient. My goodness. Let's see here. Thank you. This was a patient of Haley's. She was a patient that hadn't been to the dentist in 20 years. We salivary tested her right off the bat, and you can see in that initial test, she had the V-shaped pattern that is difficult to clear. So the treatment plan was to extract 1, 2, 24, and 25. Haley put her on amoxicillin metronidazole alongside her NSPT, and she did air polish and laser-assisted periodontal therapy. We also used ozone oil, probiotics, and clear spray, and these were her results. And it's just so exciting. Yeah, that was, my goodness, what an amazing case. So those teeth, though, the teeth that needed to be extracted, were also likely harboring a lot of bacteria. So I often even think of this situation in my patients that have wisdom teeth, and they're just hanging out in there, but maybe they're low down towards the gum line, and it's difficult to keep clean. It's hard for me to clean back there. Just some food for thought.
All right. Do we have time for one more since we got through it quick?
Yeah.
Okay.
We'll be quick.
We'll be quick. Okay. All right. So this is a patient who came in for initial. So we're giving you not just all cases that went well, by the way. We're trying to give you real life stuff here. So this is a patient that came in for salivary testing. His initial test there at the top shows that he's got TD, TF, FN. When I air polished him for the first time, those pictures up top are what he looked like after I air polished him. He just would not stop bleeding profusely. He's been a long time patient since he was a little kid. Had come back from college, gotten a job teaching, and I don't think we had seen him in a little while just because he'd been away at college. And we put an initial guide together for him. We recommended some treatment, and he never responded to the email. He had asked for his results to be dispensed via email because I think he's about 24, 25 at the time. Never responded. And then all of a sudden, that was in September, in January, he shows up in the office for a post test. And we never did any treatment on him. And I was so shocked and surprised. And I was thinking, wait, why is he here for a post test? And this is kind of one of those things where protocols get put in place when mistakes happen or mistakes are made. We ended up taking the post test, but we didn't end up charging him for the post test because he didn't understand it correctly. And we were trying to just be kind to that because I wanted to get an actual post test after we proceeded with the treatment, since it seemed like he was on board enough to come in to get a post test. He was probably on board to do the treatment. He just didn't understand it quite well, or maybe read through the document well enough. So his post test, of course, shows that everything goes up. His post test shows that we had a decrease, but also not as much as maybe I would have hoped for, considering the treatment that we actually put him through. We ended up doing NSBT. He did get put on an antibiotic. It was revealed that he didn't take his antibiotic consistently, might have even missed a day or two. And so that is what you're seeing is the results of patient compliance or non-patient compliance. He did do the oral probiotic, and he did try to take the antibiotic, but he didn't successfully take the antibiotic. I'm not calling this a fail or anything. It was just, we didn't resolve it as quickly as we wanted to. So we're still working on this case with this patient, but I just thought this was a good example. You can see my biofilm slide in the middle. I don't know if it played already, but it showed an amoeba running through the middle there. It was moving pretty quick. Amoeba sometimes move super slow, and I thought that one was a really good capture. Wherever there's spirochetes, there's usually an amoeba in our experience. And his slide was flooded with spirochetes, and then that amoeba cruising through the slide there. So that gives you a little glimpse into a non-compliant case. And then moving on to our final case, I just wanted to give you guys a variety of cases here. We've got our initial test on this patient. She came in, she'd been a patient of probably, I'd say 20 years, a long time.
Emergency.
She came in a lot for emergency. She had seen the other hygienist who had been a hygienist for 18 years that we talked about leaving. And so her case kind of got handed over to me. When I saw her for the first time, that photo up there, her gums were bright red. And I feel like that photo doesn't even do it justice, but they were like lipstick red and itchy and bothering her. And you can kind of see the like ulceration in between her bridge there that's her lower right, and the pontic, the butt midtooth and the pontic there. She just had a lot of inflammation in her gums, very little calculus, a lot of plaque prior to cleaning them, and has had a history of a lot of restorative work. Her initial test result, which was done on 11/23, I was shocked that she only came back with FN. And it was kind of, you don't want to be devastated about that, but I kind of was devastated about it. Like, wait, really? Like, her gums were so bright red, like they're itchy, they're bothering her. Like, what is happening? And so we were using HR5 saliva test at the time, and so it only detected those 5 high-risk bacteria. Fast forward to her most recent hygiene appointment, and we retested her, and her test came back, pretty similar. She had FN, FA, which were grouped together in the HR5 salivary test. And of course, a few things that we don't test for we didn't test for in the HR5, the EC, Streptococcus mutans, which makes tons of sense that she's in the red, off the charts because of how much restorative work. And that's why I included her x-rays there for everyone. Also had high levels of Streptococcus sanguineus, but she has Candida albicans. So that was an immediate referral for me to her naturopath to help resolve that overgrowth of that moderate yeast that's present in her mouth. And we will follow up with this case and see if that is the root cause or part of the problem with her redness in her gums. We've had other cases where that was linked to a yeast infection, having bright lipstick red gums. And so we are hoping that we can resolve the gingival issue by getting her the appropriate treatment for the yeast overgrowth. So those are just a few things that are a few cases that we wanted to share with you guys. And we just wanted to say, thank you. Thank you for letting us be here. Thank you for coming.
Yeah, thanks for taking time out of your busy schedules. It was fun to share and create the community within our profession. And so we'll let you take it from here, Laura. Thanks for having us.
Thank you.
Absolutely. I had so many takeaways tonight that I just have to share. I think my biggest one, just seeing all the hygienist faces out there that I do know. One, I want to say hi, but two, just you guys are speaking from the heart about culture. I loved assessing yourself, the cogs in the wheel. I think just so much to take away to help, and that we all feel what you're talking about. We've all at some point in our hygiene careers, I say, same with dentists, like this ebb and flow, right? And if we can get on the right path and then help others. So just coming here tonight and what you're giving back to the community is huge. And I hope others will reach out to you, visit you guys there at Social 630. I think it's amazing. We can't get enough to hold each other up and really build stronger communities as hygienists, and then dental teams for even the dentists to support and be a part of that. So appreciate that so much. I just want to open up to questions. Anybody want to drop in the chat? Raise your hand. Everyone's telling you what a great job you've done. So I think I'm going to kind of end with that. If there's no questions, I think the systems speak volumes if you take anything away. Not that you have to have the exact system, but I always say we can't manage people, but we can manage the systems. And I think that's what you showed, is that having a system is so beneficial. Holly, yes, let's talk a little bit about that Candida case. Can we open that up for a minute? She's asking, that case was probably eye-opening for you, Amanda, because, right, just knowing that somebody we want to say is okay if they have FN, seeing that the FA was higher really speaks to how virulent, but look what that yeast is doing. So tell us, do you want to share what you're doing treatment-wise, if you're using like clotrimazole or antifungal, like what's part of that process now that you kind of know, whoa, there's a bigger root cause than just the bacteria?
You're asking me?
Yeah.
So we're working with her naturopath.
Okay.
We have a naturopathic office that's not far, just down the hill from us. And so we're collaborating on her case together. So I'm not totally sure exactly what medication or what she's put her on yet. I haven't heard, but I do know that she had her initial appointment. And so I need to follow up with her and her naturopath. So that's kind of where that case has gotten left. I think her appointment was like either Monday or Tuesday of this week.
So I just want to speak to that, because I always say, remember, bacteria in the mouth, leaky gums, leaky gut, because we're swallowing them. Yeast is one of those that we really have to pay attention to, because people sometimes, like you said, you're seeing that bright redness. We have to remember that yeast kind of hijacks the immune system. And so sometimes those bacterial species are able to grow a little bit, what I say, undetected, but exacerbate behind the scenes. And that's why you're seeing those clinical signs. But tackling the yeast, right? I look forward to the naturopath kind of talk to you, like, let's tackle not only the mouth, but some type of nystatin, some type of antifungal. I actually like the troches. Dr. Gina, if you're on, I'd love you to speak to that, what we do in our office, but we use those a lot. And then them attacking the gut, right? So that's not coming right back. But love that. And that's to me one of the biggest secrets. I like the troches because the patient, Holly, you're asking what's kind of the secret for Candida. It's going to make She had strep mutans. It's going to make all of, right, decay more, intense. You can see her dental work. It's going to just make it more virulent. So this is a person who probably repeatedly gets cavities as well, even though they could be doing really good home care. And like you said, Amanda, like, why are her gums just so fluorescent red? And we have a minimal bacteria component, but that FA does speak to that because it's higher. So love those questions. Like to get that fungus in the mouth, right? And antifungal in there. I just really like the troches because they're melting it in the mouth and then they're swallowing it as well. But a lot of people do the nyastatins, swishes.
type that in the chat, like how that's spelled?
Sure.
Sorry, I just.
Also, I'll just interject, Laura. Can you hear me? Am I on?
Yes.
That I totally think, no, we see clinically, and the data would support that unless you aggressively, maybe that's too heavy of a word. You've got to educate the patient that during this time, and I'm sure the naturopath did, of getting rid of the candida in the mouth, we also have to focus on the gut, have to, because it's there too. And they have to get the carbs out of the diet or you're going to fight it forever. And they have got to go keto, ketones, no carbs, period. Not just get rid of the soda pop. I'm talking really scale back the carbs. Or it's just a struggle.
Yeah, that's exactly why we sent her to the naturopath, because we knew that diet is going to be key to getting that to go away.
Yes.
So we didn't want to just throw something oral at her because we knew that it's not going to, bigger problem. Yeah, there's a way bigger problem than what we're seeing orally. This just gives us kind of a window into the problem, you know, so we can see it. But that she really needed someone to be able to help her more than what we could. So that's why we did send her to the naturopath.
I think that's great. And I think, I'm sure he or she did do some gut healing along with it. But I think it's wonderful that you guys have brought everything to the table today that you have, but this ending on this, I love, because we want to speak the same language in the collaboration between the medical office and the dental office, you know? And so if you were over there before she even leaves and you say, I'm sure your naturopath is going to talk to you about getting the carbs out of the diet. I mean, people really don't believe that. So the more times they can hear it from different offices, different people about lifestyle, it can be a make or break point, not just the carbs, but I mean, that's just one main one.
Yeah. Awesome.
Well, Dr. Gina, wrap us up for tonight. Is amazing having Amanda and Kristie on. Really enjoyed that. I loved, even like you said, wrapping up with collaboration. I hope that really inspires more of you to kind of reach out, like they said, work through their ENT, but just talking to their own functional medicine doctors is always fantastic, which is going to bring us to our next. Tell us what we're doing next at our next study club, because it's also a big collaboration effort.
Yes, for sure. And great job. Yes. Thank you both for sharing with us tonight. So not next month, but the next study club in December the 4th, we're thrilled that Dr. Bill Hang has agreed to educate us. And I've heard Dr. Hang speak on 2 different occasions, and I can't get enough of it. I wish that I could go to, and maybe I will one of these days, go to his courses, even though I'm not an orthodontist and I'm not in the dental field, but his courses, are the 2 times I've heard him speak, are very relevant to me as a medical provider and very relevant to me just personally for what he brings to the table. Is such a different perspective. I'm assuming everyone here knows Bill Hang because he is so well known, but he's an orthodontist by background, and he developed the tell me if I'm saying it right, extraction, retraction, regret syndrome, meaning let's redo how we're doing orthodontics to make sure we're protecting and improving the airway while we're making the smile beautiful. His education that he brings so much deeper than that. I don't think it's like he's going to teach us technique. I'm sure he'll talk about all of that, but he has so many cases and so many stories that are very inspiring and educational. So I encourage everybody to come in December. It's a busy time of year, so if you can't make it on December 4th, definitely listen to the recording because it will be fantastic. It will be well worth your time, just like tonight was. Thank you again so much, Kristie and Amanda, for bringing your expertise to us. What else, Laura?
That's it. Love seeing everybody tonight. Look forward to seeing everybody in December, and reach out if you need anything. Have a great night.
Thank you.
Good night.